And Senator Alexander, thank you so much for taking the time to join us today. So as Margaret said, I know that reducing healthcare costs and especially unnecessary spending is one of your big priorities. I've heard you say that you want to do 2 or 3 big things and maybe a dozen small things. So what specifically?
Well, we don't know yet. In fact, I've asked all the experts, many of whom are here, to let us know by April 1 what those should be. But and
should we keep a running list here while we talk?
Well, we hope they will. But here's where that came from. We had 5 hearings on reducing healthcare costs. What I was trying to do was to move away from a perpetual argument over 6% of the health insurance market, the individual market, which Republicans and Democrats have been engaged in for.
So you're talking about Obamacare. Get away from that. Okay.
To the question of reducing healthcare costs, and I was startled really by the consistent testimony that 1/3 to 1/5 of everything we spend on healthcare in the United States is unnecessary. Now, this is from Academy of Medicine witnesses, a whole variety of witnesses before our committee. So I thought, as you said, a couple of big things, 8 or 10 smaller things. And a small thing, for example, might be Senator Cassidy and Senator Murray, Cantwell, others have a proposal to allow the use of health savings accounts when you go to a direct primary care doctor. And a direct primary care doctor is Dr. Gross in Florida, who says, Kathleen, you give me $60 a month, $20 per kid, and I'll provide you all your 90% of your health care. No insurance, no Medicare, no Medicaid, no private insurance. And if you could use your health savings account to pay for that, that's an example. A big thing might be elimination of rebates.
Senator Azar is talking about that.
Yeah, and the administration's taken a step on that.
So you support that?
Well, I'm very interested in it because part of the problem with figuring out how to reduce healthcare costs is make the system have more of the discipline of a market with the cost savings incentives that are there. And if you can't figure out where the money is going, you can't do that. Rebates are these discounts that pharmacy benefit managers negotiate with the pharmaceutical companies. It's about $150 billion a year that goes into the system sloshing around out there. And the question is, who gets the benefit of that? So there's a lot of discussion about modifying or even eliminating those rebates so we can see where the money's going and make sure the benefit's going to the patient.
So have you talked to your fellow senators, House members about it? I mean, do you really think that with a divided Congress, you can get something done over the next 2 years? I mean, Republicans controlled both the House and Senate over the past 2 years and didn't pass any significant health care reform.
It's actually often easier in a divided Congress.
Really?
To get a result. I mean, we did that with you know, the 21st Century Cures legislation with President Obama, which was a big, complex piece of legislation, the first mental health big modification we had in 10 years. We did it with the opioids legislation just a little while ago. We did it on the education side. We fixed No Child Left Behind. I've already been to see Frank Pallone, who you'll be talking with in a little while. He's an excellent leader and legislator. Greg Walden is his Republican counterpart. Patty Murray and I worked together on the Health Committee. I've asked Senator Grassley and Senator Wyden with Finance, because we share this jurisdiction, if we can look for things that we can work on to reduce healthcare costs. And we've had a couple of meetings already. And so we're trying to identify those 1 or 2 big things or 8 or 10 smaller things.
Can you get the president on board? Have you talked with him about any of your
Well,
ideas?
I haven't talked with him much about this. I've talked with Azar a lot. I like what the president is saying and what he's doing, because the president's job is really to set the agenda. And if he keeps talking about reducing health care costs, then the country will talk about it, and Azar will talk about it, and we will talk about it, and we'll get something done.
When you talk about it functioning more like a marketplace, I mean, I guess I envision, so if I need an appendectomy, you're saying in a couple of years I can go online and search prices at this hospital, prices that this doctor is charging, check out the reviews, click purchase and put it in my shopping cart?
Well, Yeah, or you could do less than that. I mean, we passed legislation last year that said you couldn't make a deal, the companies couldn't make a deal with a pharmacist and keep that pharmacist from telling you that if you paid cash for your prescription, it'd be cheaper than if you paid the copay on your insurance. So that's a form of shopping. And so another big thing that could come this year are steps toward transparency to make it clear what the prices are. Now, the problem with that is, one, it's incomprehensible to most people once you do that. But on the other hand, there are outfits like Blue Book who turn that data into useful information, say for primary care doctors. There are 300,000 of them. And you and I might not want to or be able to sort through all this information, but our primary care doc might, and might say, if you want a better outcome, a better experience, and a lower cost, you go here instead of here.
You were saying President Trump is good at setting the agenda. He did talk about prescription drug pricing, reducing that in the State of the Union. And you mentioned ending the rebates. Are there other things that you'd like to see done in that space, giving the federal government the ability perhaps to negotiate Medicare prescription drug prices?
Well, Secretary Azar's taken a step on that. He's taken a step on there's always a discussion about importing prescription drugs. What people don't realize is we import a lot of prescription drugs, but we just do it from sites overseas that are approved by the FDA and the specific medicine is approved by the FDA. So there's some talk about that. Biologics is a new form of medicines. Which isn't as available, and the competition isn't as robust as it could be to keep prices down. The rebates, if we didn't have them, for example, we might be able to see more clearly where the dollars were going, and that could lower prices for patients. The one thing, go ahead.
I was going to say, there was such a powerful hearing on this on the Hill yesterday in the Senate, and I know that the senators voiced the frustration I think that many Americans feel when you hear that we are paying 40% more than our counterparts in Europe or in Canada for prescription drugs, and when it comes to other countries, sometimes 2 and 3 times what they're paying. So what about this international pricing model? Do you think that would be a good idea?
Well, again, Secretary Azar is taking a step for that, but we have to be. There's one reason for that, is because our pharmaceutical companies, in connection with the National Institutes of Health and all the research universities, are creating most of these drugs. They're spending a huge amount of money and taking the long time it is to get these miracle drugs through. Dr. Collins testified before our committee, the head of the National Institutes of Health, about the cancer drugs, the vaccine against influenza. The president talked about a cure for HIV/AIDS. All of these things are mostly being created by research in the United States. So if you don't spend the money on research, you don't create as many new drugs, and that's part of the cost.
But again, as you mentioned, NIH, I mean, that's taxpayer dollars. That's not a cost to the pharmaceutical companies. That's a benefit to them.
That's true. But once the university does its work, it then takes 6, 8, maybe 10 years to go all the way through the system with a new drug, for example, to identify the systems for Alzheimer's, or to even retard those systems. And in a number of cases, companies have been very close to that. I mean, these are billion-dollar exercises that somebody's got to pay for. So anything we can do to, and then if we allow other countries to approve our drugs, do the American people really want that? Because we take for granted when we go into the pharmacy that it's safe. We don't even think about it.
Is that what you think would happen under the International Pricing Index?
Well, that's the reason. Well, that's the reason why every Secretary of Health and Human Services has refused to support the idea of importing drugs that the FDA doesn't approve the facility and approve the drug before it comes in. The worry about safety.
Let's go back to the cost overall, that issue. There was so much finger pointing at yesterday's hearing, the big pharma CEOs pointing at insurance companies, pointing at the pharmacy benefit managers. When you look at healthcare costs overall, do you see one party that is primarily responsible for the skyrocketing bills that Americans are paying, or is the system as a whole flawed?
Well, part of the reason is that the system itself, unlike any other system I can think of in our society, at least any other large one, operates without the consumer knowing what the cost is. I mean, if you, as you get older and you get your hospital bills and you read them, you don't have any idea what somebody has paid for the medical service that you've had. And finding a way to, for example, a new senator is Senator Braun from Indiana. He had 1,000 employees in his company. He wanted to be on the health committee because he spent 10 years really fighting with the various interests in healthcare to lower his company's healthcare cost and give his employees a better outcome, a better experience at a lower cost. So there's an example of you have more transparency and aggressive person, either a primary care doctor or an employer working on behalf of a patient. We can reduce costs. And everybody, I think, has some share in the blame. But the system itself, it's impenetrable. And we have these hearings on prescription drug costs, and nobody knows at the end of the hearing where the money's gone.
Senator, before we go to the audience for questions, you mentioned at the beginning you want to get away from this continual debate over the Affordable Care Act. Mm-hmm. Does that mean that Republicans are going to stop their efforts to sort of chip away at it and dismantle it?
Well, I think as a Republican legislator, I look for where can I get a result? Where can I get something that Patty Murray and I and Frank Pallone and Greg Walden all can agree on? And we've proved over 8 years that's hard to do on Obamacare. So I'd rather work on this other set of issues for the next couple of years. There's some promising things out there that some of them are unexpected. Association health plans is an area in insurance that the Secretary has, it's not a new idea. We had a lot of it before the Affordable Care Act, but it basically allows employees of smaller companies to be able to buy the same kind of insurance that employees of larger companies have, pre-existing condition, benefits, all this. And that's beginning to come back in a good way to help the people who are left out of the individual market.
That would be wonderful. Well, let's go to our audience. I know you have a lot of questions out here. And if you would raise your hand, identify yourself, and stand up when you ask your questions. We have one back here.
Hi, my name is Darren Fenwick. I'm with the College of American Pathologists. Thank you, Chairman, for being here. My question is, in terms of reducing costs, do you think there will be, or has there been any discussion of laboratory-developed tests, specifically as a means to develop targeted interventions for patients who may need them to reduce costs?
You're getting into a pretty specific area. The area where I've gotten into laboratory-developed tests was in the FDA guidance that we had a couple of years ago, which was discouraging them and making precision medicine and that kind of research and medical practice difficult. And the FDA stepped back a little bit and left some room for that. I'd be glad to take a look at laboratory-developed tests. Tell me a little bit more about where you're headed with that.
Yeah, so right now we know there's been some discussions to potentially regulate laboratory-developed tests, and also sort of whether it's not FDA oversight, as you correctly pointed out. And so, I mean, I think the idea being that if you can develop, and there's freedom to be able to develop more targeted tests for patients to get them faster treatments and to get them targeted treatments and targeted interventions, then eventually it could potentially reduce costs.
Well, it could. That's true. You have a split jurisdiction between CMS and the FDA, and we've had one hearing on that. I haven't approached it recently, but that's a good point, and I'll put it on the list. Thank you.
All right. Do we have any other questions here? All right. Well, Senator Ota, I would love to ask you about the fact that you have announced that you are going to be not running for re-election, so leaving the public stage in Congress in a couple of years. You run for president twice. You've been governor of Tennessee, education secretary. What would you say in this realm, in the healthcare realm, what would you like your legacy to be? What do you see it as? Or are you going to accomplish it in the next 2 years?
Well, what I'd rather think about what I could accomplish in the next 2 years, because 2 years is a long time, and I'm really very privileged to have a chance to be chairman of this great big committee that deals with health, education, labor, pensions. I've worked with Patty Murray, who's a very effective legislator on the Democratic side, and when we get together, we can get things done. So what I'd like to do, among all the things we've just discussed, is look back on what we've already done and give appropriate oversight to it. Let me give you an example. The opioids legislation, you know, while all the Kavanaugh stuff was going on last year, at the same time we had 72 senators and House members working on the biggest public health bill probably passed ever in terms of an epidemic to fight opioids. But at the same time, that meant we were taking away from 25 million people who live with terrible pain their most effective painkiller. And so we had a hearing on pain the other day to try to make sure that the steps that we need to take when we do this don't create lots of trouble over here. For example, we've put $500 million into non-addictive pain medicine. So if you don't take opioids, you have something else to take, and to encourage other therapies. So oversight of what we've already been working on, electronic health care records, making sure that the Cures Act, the Mental Health Act, the Opioids Act do what they're supposed to do is still a pretty big part of the legislative job over the next 2 years and beyond.
Are you pretty proud, though, of your opioids measure that was passed, signed this fall?
I thought it was terrific, and it's a good example for people who don't think we're able to do things. I mean, if you, I suggest you look at Washington as if it were a split-screen television. On one side, last September, you had as much acrimony as you could think of, you know, food fight over the Kavanaugh nomination. On the other side, 72 senators working together to produce what the president called the biggest piece of public health epidemic legislation in our country's history. They all had something in it. We all worked together on it, and it took on a lot of cooperation, including with the House, to get it done. So I'm proud of that, and that happens fairly regularly. It doesn't get as much, you know, if a plane crashes, it gets a lot of news. If a plane takes off successfully, it's not news. So we're working on planes taking off successfully and getting things done, and I think one train that's moving to the station is a piece of legislation with bipartisan support on reducing health care costs, hopefully by this summer.
Mr. Chairman, thank you so very much.
Thank you.
Everyone, Senator Lamar Alexander, thank you, sir.